Go.
Hi, my name is Lynn, and this is my video for the 2023 CCT presentation. Today I will be presenting on traumatic brain injuries. So first things first, what is a traumatic brain injury? According to the Mayo Clinic, a traumatic brain injury is defined as a violent blow or jolt to the head or body. An object that pierces the brain tissue like a bullet or a broken piece of skull bone may also cause a TBI. Mild forms of traumatic brain injury may temporarily affect brain cells. In more severe cases, bruising, tissue tearing, bleeding, and other physical damage may occur. These injuries may lead to long-term complications and even death. Symptoms of a TBI have a broad range, both physically and mentally. While some signs or symptoms may appear immediately, others may take days or even weeks to present themselves. Mild symptoms can include headache, nausea and vomiting, fatigue, drowsiness, problems with speech, dizziness, blurred vision, ringing in ears, sensitivity to light and or sound, loss of consciousness, memory or concentration problems, changes in mood or behavior, and changes to sleeping patterns. Moderate to severe symptoms include loss of consciousness, persistent headache, or a headache that worsens. Seizures, dilation of one or both pupils, clear fluid from the nose or the ears, coma, or posturing may occur. Children, on the other hand, may not be able to communicate their symptoms, so when treating these patients, be sure to be looking out for these symptoms of a TBI, such as changes in eating or nursing habits, changes in irritability, persistent crying or inability to console the child, changes in attentiveness, changes in sleep behaviors, seizures, loss in interest in favorite toys or activities. TBIs at the base of the skull can cause nerve damage to the nerves at the base of the skull. Cranial nerve damage may include paralysis of the facial muscles, loss of sensation in the face, loss or altered sense of smell or taste, loss of vision or double vision, difficulty swallowing, dizziness, ringing in the ears, and hearing loss. Treatment in the field for these patients, first and foremost, remember your ABCs: airway, breathing, circulation. Airway management can include RSIing your patient to maintain a patent airway. Etomidate is preferable in trauma patients. Propofol is beneficial with TBI patients. Ketamine should be avoided in all patients with an increased ICP. Hyperventilate your patient. Hyperventilation in TBI patients causes cerebral vasoconstriction, which in return reduces cerebral blood flow and volume to decrease the oxygen supply. Hyperventilation decreases ICP and relaxes the brain. Signs of central nervous system herniation include increased blood pressure, bradycardia, decreasing GCS, dilation of one pupil, and posturing. When these symptoms are present, ventilate your patient 12 to 20 breaths per minute to maintain an end-tidal of 35 to 40. If in your scope of practice, administer mannitol to assist in increasing ICP. Remember IV placement. If seizures occur, then treat accordingly. When head injury patients deteriorate, first check for proper airway, adequate oxygenation, and adequate blood pressure. Also avoid hypoxemia and hypotension. The resources that I used was from my West Virginia protocols, National Institute of Health, Cleveland Clinic, and the Mayo Clinic. Right now, I'd like to tell about the one TBI patient that I did encounter. This was last year. I had a patient that was in her probably mid to late 20s. She was pregnant. Decided that at 3 o'clock in the morning, it was a good idea to ride her bicycle with no brakes, no helmet, and no shoes. It was a busy day. We ran a whole bunch of 911 calls. I think I got to bed like 1 o'clock in the morning. I was sound asleep. Tones go off. They tell us like what's going on. I'm like, there's no way. This has to be, it's a spoof call. This can't be real. Someone's just pulling our legs to get us out. All the way out there, I'm like, this can't be real. No, ain't no way. I still call our medical command like, hey, I have a question. They didn't cover this in medic class. It could also be that it's 3 o'clock in the morning and I'm not thinking straight, or it could be the pregnancy brain that I was pregnant with. So what would be the pain management for a pregnant person? Does it change? or does it not? Our medical command couldn't even tell me. They said, hey, we're going to call our doctor, call us back. Okay, cool. So, get on scene, I'm like, oh, okay, this is real. There she lays. So, rode down a really steep hill, no brakes, no helmet, no shoes, bottom of her feet were pretty well torn to pieces from trying to stop herself, went across the main road and smacked right inside the side of a parked car. She hit the car so hard that it actually moved the car. So with that being said, I had a really good crew. I had good firefighters on scene. I had off-duty personnel responded from their house. They were helping to get her packaged up. She had an obvious broken wrist. I was trying to talk to the other people who were on scene with her, who knew her. Well, turns out they are all high on meth. So that made it even more fun. Baby Daddy, who that is literally what he presented himself to me as, is Baby Daddy. Knew her first name, did not know her last name, barely knew her birthday. Did not know, of course, any allergies, medications, anything. I even asked about how far along in her pregnancy. Baby Daddy wasn't 100% sure. The patient is confused. She's not really fighting us. She's very repetitive in her questioning. And when I asked her about her pregnancy, she doesn't even remember that she's pregnant. She was very skinny. So, and as far as long as what the Baby Daddy said that, she was pregnant, wasn't really adding up because she should be definitely showing, especially because this wasn't her first pregnancy. So then we got to question, was she really pregnant or like what's going on? Still treated it accordingly. I yelled for flight to have her taken to the nearest trauma center, which in our area is about 2.5 hours away. So we got her packaged up, pupils, one was more dilated than the other. She was repetitive with her questioning. As far as airway management, she did have broken teeth, so that could create a different problem as far as a more complicated airway. And then flight got on scene. They did RSI her and go ahead and just take her down, and they went ahead and got her in the air. Whenever I received feedback from the flight crew, they did tell me that she did have a brain bleed, so she spent hours in surgery for that. She also had to have facial reconstruction done. And she ended up living. She was brought home, I think, about a week later, and then she had seizures after that due to the traumatic brain injury. Sadly, she did pass a couple months after that, but from an unrelated cause. I hope you all have enjoyed my video as much as I have enjoyed presenting it to you.